Trinidad and Tobago. You have just tuned into the most accurate and up-to-date source of information on the national COVID-19 response. That is the Ministry of Health's COVID-19 Media Conference. Today's panel of presenters are the Honorable Terence Dialsing, Minister of Health, and Dr. Roshan Parsram, Chief Medical Officer. I am Odessa Curlane, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. We begin with Dr. Parsram, who will present the latest clinical update.
Hi, good morning. Thank you, Ms. Curlane. Good morning to the Honorable Minister. Good morning to members of the media, members of the viewing and listening public. So we'll begin with the COVID-19 update. If I could have that graphic, please. So it's update number 1,148 as of the 12th of July 2022, which was yesterday. Fully vaccinated still at 51%. New positive cases 104 over that period. Total hospitalized patients 91. Number of deaths reported during the period 3. And condolences to the families of those persons who would have lost loved ones during that period. Total active cases now stand at 6,000. And again, the vaccination status is largely, in terms of hospitalization, those who were unvaccinated and deaths as well. In terms of further breaking down the hospital levels, those 91 patients spread among a number of facilities: Couva Hospital and Multi-Training Facility 34, 2 in ICU, 3 in the High Dependency Unit, Cora 10, Augustus Long 21, Arima General Hospital 6, St. James Medical Complex 13, Scarborough Regional Hospital Fort King George 6, and Scarborough General Hospital at Signal Hill 1 person. Before I go to the other presentation, we just give a brief update on the monkeypox regional situation. So between January 1st and July 7, 2022, a total of 7,892 confirmed cases, including 3 deaths, were reported from 63 member states. If you remember, last week's update would have said about just over 6,000 cases in 58 countries, so an additional 5 countries added to the list. There are 3 fatal cases reported in Nigeria and Central African Republic, 2 cases there, and there would have been 1 in last week's report. Again, similar to last week, 82% of the cases have come from the WHO European region, 15% in the region of the Americas, in which Trinidad and Tobago is a part, and 2% in the WHO African region. So if I could have the first slide of the other presentation, which is the masking presentation. It says way forward, general recommendations for mask use. Next slide, please. Yeah, so wearing a mask in some settings will soon become a voluntary practice. Some individuals may choose not to wear masks while others may continue wearing masks. Moving forward, it is important to respect the personal choices of others and understand that it is indeed a personal decision. And although there will no longer be the force of law in most situations, it is certainly remaining an important public health tool in the management of COVID-19. Next step. Next slide, please. So when looking at choosing to wear a mask, one should be informed by your own personal level of risk in a particular setting, and one should assess his or her surroundings and make informed decisions to reduce his or her risk of contracting and or spreading COVID-19. If you look at the interplay on the right-hand side in terms of disease, you could see that the environment, the host, and the agent have a critical role in determining the outcome of disease, both in terms of getting a disease and, of course, spreading a disease, as well as the severity of the disease. So looking at the agent, we look at the virulence and the infectivity of the particular pathogen. We look at the host, for example, vaccination status, medical illness, types of medication you may be on, and in the environment, airflow, household, healthcare facility, or if it's a travel-related environment. Next slide. So we take a three-tiered approach to assessment of risk. So you consider first the population in which you reside, and of course for persons that are traveling abroad, the population that you're going to visit, and there will be a lot of travel over the next couple of months, I suppose. Consider your own individual level risk, inclusive of the vaccination status, and I'll go into a little more detail about the individual level risk. Consider the site or the event-specific risk. Next slide. So when beginning at the population level, one can gauge the general population level risk by viewing the Ministry's daily COVID-19 updates, COVID-19 dashboard, weekly press conferences for information on number of new positive cases, number of new deaths, total active positive cases, and the circulation of various types of variants. In Trinidad and Tobago, the dominant strain right now, variant of concern is Omicron. We have detected BA1, BA2, BA4, BA5 variants, and they are in circulation at different levels. The dominant sublineage remains BA2 at this time. Next slide. So the next slide gives you an idea of the dashboard, as well as on the left-hand side some more details, which would show age, sex, gender distribution, for example. You can get new reported cases, 7-day rolling average on this slide as well. And this is available at the Ministry of Health's website. Next slide. So we'll go further now into individual level risk. So there are certain special groups of people that have a greater risk than the general population. And some persons are more likely to become very ill and should continue to wear their masks. And these include the immunocompromised persons, persons with underlying medical conditions, obese persons, meaning a body mass index greater than or equal to 30. And you have noted internationally, persons who are obese, even without comorbidities, have had sequelae that are severe in terms of COVID-19. So in terms of number 4, if we could have the next slide, we look at pregnant women, continuing the list. Individual aged 60 years and over, again, even if you don't have a comorbidity, and those unvaccinated and not fully vaccinated. And the risk here is really, if you could go back one, please. The risk here is really in terms of getting severe disease, and of course death. The risk is greater in those who are not fully vaccinated. So this slide begins now to look at site-specific or site event risk, and the following factors should be considered when deciding whether or not you should wear a mask in a given site at a given point in time. Is it indoors? So you're asking a series of questions. Is there adequate ventilation? Next slide. How long would you be there, and do you know who you're interacting with? If it's a large group of people who are unknown, for example, and I'll give specific details as it relates to supermarkets, for example, later on. Is it crowded, or it is an off-peak time? Are vulnerable people in that setting, for example, geriatric homes? Are others complying with public health measures, meaning are other people in that setting wearing masks and maintaining social distance, etc.? Next slide. Some settings where mask use is encouraged, and I wouldn't go through the entire list, but it will be put up on the Ministry of Health's website. Certainly all retail settings inclusive of supermarkets, groceries and malls, public transportation hubs, ports of entries, places of worship, for example, cinemas and theaters, spas and beauty salons. Next slide. Looking at settings in a little more detail, so ports of entry and their respective conveyances, example, airports, seaports, airplanes, helicopters and ferries, because of the close interplay between persons, they can't maintain that social distance. It's a closed environment in most instances, and of course there's recirculation of air in some instances as well. Public transportation, again, crowded transportation hubs, buses, taxis, maxis, bus terminals are high-risk environments. Buildings with high concentrations of people and low airflow, example, crowded workplaces where physical distances cannot be maintained and there's inadequate ventilation. Other congregate settings, next slide. Correctional and detention facilities for adults and juveniles, children's homes, geriatrics homes, homeless shelters, and these are vulnerable people, so generally we want to protect them. So if staff or visitors go into those environments, we expect that they maintain the mask wearing so that they can protect those vulnerable people that they take care of. So this next slide will give an example of how within the same setting you can have varying levels of risk. So this is a beach from the picture. If you go left to right, you see lower risk, and you could see clearly on that picture in the green picture that the persons are well spaced. It is actually not ad hoc. They're very, very well spaced out. There seems to be some guidance as to where to place your umbrellas and chairs on the lot, and it poses a lower risk. It's an outdoor environment as well. The medium risk scenario seems a little more ad hoc. They're closer together. And if you look at the higher risk scenario, still on the beach, You see a lot of chairs all the way together. People are overlapping each other, and it's an ad hoc relationship in terms of seating and persons without any major control. So that represents a higher risk of transmission. Next slide. We look at the same setting can also be categorized different risk levels for different people. For example, at a grocery store at non-peak hours may be a medium risk setting for the consumers, but it may also be a high risk setting for someone who works throughout the day, for example, a cashier, because they would interact with a large number of people coming in who are unknown to them. Physical distancing and protective screens as well as masking remains important for those particular individuals, and it all depends on the length of time that you spend in that environment. Someone may come in, get one item, and be out in 5 minutes, will be at a different level of risk of someone that comes in with an entire family and spends about an hour shopping. Next slide. So masking will be mandatory at all hospitals, both private and public, and other medical facilities, for example, general practitioners' clinics and dental clinics going forward. Next slide. We are removing your face mask necessitates the practice of other public health measures in order to reduce your risk of contracting or spreading COVID-19. And of course, as we have said before, hand hygiene, respiratory hygiene, physical distancing, and most importantly, staying at home and away from your places of work and school when displaying any flu-like symptoms will decrease the risk of transmission. Last slide. So again, we do them all and do them consistently, wearing a mask when required, watching your distance, and washing your hands. So thank you very much for the brief time this morning.
Thank you, CMO. We now go to the Honorable Minister for his presentation.
Thank you very much, Odessa. So I will be very brief this morning because the CMO gave a very detailed presentation, and I'm sure there will be many questions and answers, and we would like to get in as many as possible. So the vaccination update, complete vaccination, 51.1% of the population, 714,729 persons. Number of persons boosted, 166,685. The number of children 5 to 11 vaccinated, 2,236. And may I just remind parents and guardians and children, the Pfizer pediatric vaccines for those 5 to 11 is still available at health centers and so on. So whilst the adult Pfizer vaccination program has come to an end as of June 30th, the Pfizer pediatric vaccination program is still ongoing. Now that schools are out, maybe it'd be a little more convenient for parents and guardians to take their children 5 to 11 to be vaccinated. So I think that's it. I would like to leave as much time for questions and answers as possible.
Thank you, Honorable Minister. Next up is the question and answer segment. You're reminded that you representatives of each media house, you're asked to ask one question and 2 brief questions thereafter. Please ask your questions one right after the other. We begin with AZP News.
Good morning, Private Harry, AZP News. Good morning, Odessa. Nice to see you. My first question is for the CMO. CMO, what happens now to the quarantine period if someone contracts COVID-19 and for primary contacts? Do they remain the same, and how long is this period now? And Minister, what happens now to the public health regulations? Are they still in place for the pandemic of COVID-19? You know, what sort of measures, in other words, would it still be used in terms of COVID-19?
So I'll take the second question first. So the public health regulations, as the CMO indicated and as I indicated last week, the new regulations that will come out by Saturday the 16th will indicate that masking is now mandatory only in healthcare settings. There are little or no other public health regulations. What we are doing with this is putting forward to the population a very easy to understand and common sense approach to risk mitigation at the personal, family, workplace, community setting, and social level. Mitigation strategies are now squarely in the hands of the public, even though most or all public health regulations have been lifted. Okay, thank you very much, and CMO.
So, I mean, from the CMOH level, the quarantine that we have been doing over the last few months have been primarily to the household contacts. So we're looking at primary contacts for the household. Generally, secondary and tertiary contacts are not quarantined to the extent that they were in the earlier part of the pandemic. Isolation, meaning when persons actually are confirmed positive or highly suspect positive, continues. Generally speaking, we're looking at about a 10-day period at this point in time, and the CMOHs are putting together a position to probably reduce that a little further in the coming days. But I think it is important to maintain, as I said in my last bullet, that if you are ill, that you stay away from the crowded spaces, because that is the way COVID-19 spreads. Omicron by itself is an extremely infective pathogen, can spread to a number of people in a small space of time, given the way it is spread. So again, we maintain what we have in place for now, and we'll be reviewing it in the near future.
Thank you, CMO. We now go to Newsday. Newsday has some questions.
Good morning. This is Paula Lindo from the Newsday. So my first question is to Dr. Parasram. You mentioned that we have detected the BA.5 variant in Trinidad. Could you tell us, what was the sample size where that was detected? And second, we've been seeing reports from the US where that particular variant is even easier to spread than, say, the BA.2 variant. So how concerned are you that it has been detected, and do you think this might be cause to not lift the mask mandate? Thank you so much.
So generally speaking, yes, the BA.5 was last week Friday. We would have confirmed in a sample. The week before, we would have confirmed BA.4, as I said in the press conference, I think last week. So generally speaking, they are sublineages of Omicron. The data suggests so far that we have, at least at this point in time, that yet they may be more infective in terms of transmissibility. None of the sublineages of Omicron have shown really to be more virulent, meaning that they don't cause more severe disease. What we are concerned with most importantly at this point in the pandemic, where we've been in it for 2.5 years, is the impact on the hospitalization, the impact on the number of persons that have passed away due to the disease itself. Looking back over time, we see that the number of, when I presented the hospital statistics, for example, we see there are only 91 people spread across various facilities, which is actually lower than April of 2021 in terms of the number of hospitalizations. So expectantly, we may expect an increase in the number of positive cases, but once that doesn't redound to concomitant increase in the hospitalizations and the death, then the concern at least will be a little less. But of course, there's always the concern with new variants, a brand new variant coming out of nowhere, as we saw in November of 2021, where the last variant, Omicron, began in South Africa. So there is a concern, generally speaking, that the pandemic is still here with us. But taking away the legislation related to the mask doesn't mean that the masking is no longer required. It means that the onus, as Minister has said, is now on the individual. It doesn't have the force of law anymore in most spaces, but it's still recommended, as my presentation would have highlighted certain areas. And of course, we will put onto the website a greater list of where persons will be encouraged to wear it in those high-risk settings. So there is always a sense of trepidation when we do a change as it relates to a public health restriction. But as I said, it doesn't carry the force of law, but we expect that after 2 years, persons would have learned how to manage COVID-19 and live with COVID-19. And I don't expect the day after the mandate comes off that everyone will take off their mask at the same time. It's something that we don't want to see happen. People should determine their risk and act accordingly. It's almost like taking off the training wheels from a bicycle. We have had a training period. I think the majority of the population know the measures to take in the event that how to protect yourself and your family from COVID-19, contracting and severe disease. There are vaccines on the market. We have the systems in place so that you can protect yourself, but it is a time of nervousness, if you want to call it, to see what will happen after that particular date. But really, from a health perspective, we expect that the lessons learned over the last 2.5 years will not be lost overnight.
Thank you, CMO. We now invite Guardian Media Limited for their questions.
Hi, morning everyone. Rashad Khan, Guardian Media Limited here. Both my questions this morning would be for, well, either the CMO or the Minister, whoever wants to take it. The first one is on the mask, the new mask policy. You would have mentioned, CMO, certain settings which the masks would be recommended, so like in the supermarkets, in the cinemas, and public transport. But now it's just a recommendation. Within the policy now, is it legal for somebody, a business owner or any of these people, to say, hey, what I want to make sure that everybody that's coming into my establishment has that mask on and wears that mask? Is that something allowed? And my second question is to deal a bit with monkeypox. Can we have an update on our preparations for monkeypox? Because I know there was some stuff such as the building capacity for genetic sequencing, local testing capacity, as well as getting smallpox vaccines for the population that were kind of being worked on. Thank you.
Yeah, so thanks for the question, Richard. So let's take the first question, which we addressed last week, and we have been addressing time and time again, about the authority of business places to determine who comes in. By law, as we said, a business place, and you will see the signs, a business place can determine who comes in. You will see signs saying no sleeveless, no hats, no barefoot, no short pants. And this has been cleared by the Attorney General that any business place has the authority to determine whether someone comes into their establishment with a mask or without a mask. On the issue of monkeypox preparedness, between May 20th and today, on May 20th, we started our monkeypox preparedness when I convened a meeting with PAHO, CARFA, Ministry of Health. Coming out of that meeting, we did put out a press release that same day, alerting persons of what steps they can take. We also put up a hyperlink for people to go on to check the countries which are continuously updated as to where monkeypox has been discovered. The latest PAHO WHO summary as of 9th July, so this is 9th July, says between 1st January and 7th July 2022, that's the period they were looking at, there were a total of 7,892 confirmed cases, the vast majority of which are in Europe. In the Trinidad and Tobago context, I did indicate back then that we were looking at local and regional testing capacity. CARFA has the capacity and has been testing samples from the CARICOM region, but we have not sent any samples to be tested as yet because we have no suspected cases. Did we send any?
Yeah, but they weren't suspected, but we sent to test the system.
Yeah, we didn't have any suspected cases, but we just sent some to test the system. In addition, PAHO is turning over to the Ministry of Health today our test kits, which will be used at the Trinidad Public Health Lab to test cases. We expect that once those test kits are handed over to TPHL between today and tomorrow, it will take another week for them to do their validation and so on. But as I said, there is already capacity at CARFA for the region, and as the CMO has just reminded me, we have sent 2 test samples for validation. So that's where we are. On the vaccine front, we are in the market for vaccines. Jynneos vaccine, I believe it is called, Jynneos, and also the antivirals. So we have been talking to all our international agencies to source those. But you know, something rather unfortunate is happening on the vaccine front. And I thought that COVID and the lack of COVID vaccines for small countries would have taught the global community a lesson. What we are seeing globally is that the bigger, wealthier, richer countries that have the factors of production are once again, as they did with COVID vaccines, stockpiling vaccines for their populations. And countries like ours are once again at a disadvantage. That is regrettable. I would have thought that the lessons learned out of the COVID experience, where Dr. Tedros said no one is safe until all of us are safe. I think if I could use this platform to make an appeal that the monkeypox vaccines should be available on a more equitable level to all countries based on not only their population size, but their risk profile and so on. So, Richard, thank you very much for raising a very important issue, and I hope I gave you a fulsome answer.
Thank you, Honourable Minister. We now invite questions from TV6.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question is for the CMO. CMO, I just wanted to find out how many BA5 cases have we detected thus far, if you could provide me with that answer. And second question is for Minister. Minister, you mentioned that businesses would still be able to determine who comes in without a mask and so on. Is there a difference between a private business and a public business? The CMO also mentioned that certain places mask wearing would be recommended, like let's say on the ferries, PTSD buses, and so on. Could, like let's say the ferry service, mandate people to wear face masks, even though there is no mandatory face mask wearing except for within the healthcare setting? Thank you so much.
Yeah, so I will take the second part. So as you see across the world, different entities can make that decision to have a mask mandate. So yes, different entities, they will have that authority as they see fit to determine who comes onto their property, or as you say, the ferry, or going to Tobago or wherever. However, Alicia, it must be noted, and we want to encourage people, if you are going into these settings which encourage the transmission of COVID, to wear your mask. And that's what I said when we put it out there. It's easy to understand and it's a common sense approach. And if I may, Alicia, I think an analogy is very good to answer your question. If for some reason, and it will not happen, but if for some reason the global community decides tomorrow to drop all laws regarding seatbelt wearing, are you as a responsible person going to stop wearing your seatbelt? I think the answer is no. So what we are doing is asking people, weigh your risk. The CMO went through in detail the types of situations, the proximity you are to people, the fact that you are with strangers, you don't know their vaccination status, so you're going to Tobago on the ferry, you don't know the vaccination status of the person next to you, they could be an asymptomatic carrier, wear your mask, right? So that's why I said, and I think the seatbelt analogy is the best way to describe it. If the law for seatbelts, for some reason, and it's not going to happen, was ditched tomorrow, I will still wear my seatbelt. It's my safety. It's my family's safety I'm concerned about now. And that's why I said we are putting the responsibility now on the individual, at the individual level, the family level, the community level, the workplace level. Okay, so I hope that that answers that question again. Thank you very much, Alicia.
So yeah, in terms of your detection, there was one case of BA4 detected Friday before last week, and there was one BA5 detected on this Friday gone. So one of each so far. The sample size was about 18 to 20 in either case.
Thank you, Minister. Thank you, CMO. We will now move into the second round of questioning, and we'll begin with Guardian Media Limited.
Hi, morning again. So I want to touch again a bit on monkeypox, and I want to get the CMO's thoughts and comments on this. I've been monitoring not only the epidemiological data from monkeypox, but also people's reaction to it, right? And the news of like the monkeypox in Jamaica. And there seems to be a bit of a misconception that this is a disease for only men who have intercourse with other men. And there's also now a stigma some people are perpetuating with the disease. I just want to get your comments on that. Is that something we should be wary of?
Yeah, so Rashad, I will enter into the fray here. As with all transmissible diseases, and let me just go back so I could be consistent. When COVID first happened, and I remember saying distinctly in early 2021, when it was not named COVID, and they were trying to make links to China, I clearly remember saying, let's not engage in xenophobia. And I remember the Express on page 3 carrying that as a headline, that the Minister of Health saying that this is not about xenophobia. There is a move these days to stop naming viruses after countries or peoples. Unfortunately, we still have the remnants of that with the Spanish flu. But you would notice when COVID first came out, it was not designated a name. It was then given a nation or person neutral name, COVID-19. Discrimination and stigma does not help. And let me give you another example. There is a virus called the Mayaro virus, correct? Only found in Mayaro in Trinidad and Tobago. If that virus were to become virulent and transmissible and went around the world, would we like Trinidad and Tobago to be associated with it as the Mayaro virus? My point is, I have also read the reports that you have read, and we must not stigmatize any person or group of people. This is an area of public health that has the potential to affect any one of us, especially if we are in close skin-to-skin contact with someone. So we read the reports. There is some data to suggest what you are saying, but I think the best thing that we could do is not to stigmatize any person or community, but take steps to protect all of us. Just like in COVID, Dr. Tedros said, no one is safe until all of us are safe.
Thank you, Honorable Minister. We go to TV6.
Hi, thank you again. Minister, just for a measure of clarity and so that the public clearly understands, because you went back to, again, personal responsibility and you used that seatbelt analogy, well used. But some people might actually decide not to wear a seatbelt. I might not, but some people might, based on what they might say would be their level of risk. So let's say a person decides to board the ferry. They think they're healthy. They don't have any comorbidities and so on. But they decide to board the ferry without a face mask, or they decide to take it off because they feel that they're at a lower risk and they have no problem with it. What happens then? Does anybody have the authority to enforce it, to say that you have to put it back on? I just want that level of clarity.
Thanks. So the only way that could be enforced, as I said, is if the entity decides that their conveyance, their retail shop is a mask-only entity. Right now, the regulations that will come out on Saturday night will indicate that the only environments where masking will be mandatory will be healthcare facilities in both the public and private sector. Otherwise, it is optional but highly recommended based on the risk analysis that we have presented to you and that will be on the Ministry of Health's website. It is personal responsibility again at this stage of the pandemic. We are now 2.5 years into this. If people choose not to be vaccinated, which gives them that extra level of risk, well, that's their personal decision. Okay, thank you very much.
Alicia, you have some more questions?
Yes, I have one more question. I wanted to ask Minister, what is the and you may have mentioned it, but what is the vaccination levels looking like among the 5 to 11 age group, and what is the daily, what are the daily figures in terms of that vaccine uptake?
Yeah.
We brought in 40,000. You know, is it looking good? Is it below satisfactory? I just wanted to find out.
Yeah, thanks a lot. No, it's looking bad. So, as I indicated, we started the 5 to 11 vaccination program on 25th of May. We brought in 40,000, just over 40,000 doses, which could vaccinate 20,000 children with 2 doses. And so far, parents have sent 2,236 children for vaccination. So it's pretty poor, because a lot of parents have been misled by some local professionals who should have known better, but nothing that we can do about that. I have spoken about those misguided opinions being put out there. So 2,236 children. The daily vaccination figures, this is for yesterday, a total of 119 doses were given out, which is pretty low. And this is both first doses, second doses, boosters, and everything. So that's where we are at this point in time, Alicia. Thank you very much for that.
Thank you, Minister. We invite Newsday for additional question. Newsday.
Hi, sorry, I had put up my hand by accident.
Okay, thank you very much. We have come to the end of today's media conference. We ask that you please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are available for everyone 5 years of age and above. If you have not received your COVID-19 vaccine, please get yours now. Remember, the vaccines are safe, effective, free, and available at multiple locations. We also invite you to visit our website at health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we continue to roll back restrictions, let's continue to observe the 3 W's. Goodbye for now.
After we have been exposed to an infection, our immune system remembers the threat, in particular by producing antibodies. These are proteins that circulate in the blood and throughout the body. They quickly recognize and disable the invader upon contact.